Okay, so now we're going to talk about the anterolateral spinothalamic pathway. And the pathway goes through the white commissures of the spinal cord, and I have the picture that I drew over here. Lateral spinothalamic is right here, the red area, and the ventral spinothalamic is right this area. So the information that goes through this tract is pain, temperature, and poorly localized touch. And the origin is going to be free nerve ending, specifically TRP channel. And the TRP channel is sensitive to acidity, so hydrogen ions, heat, as well as pain. Okay, anything that causes pain, basically. So we have our, actually let me start here. We have our guy over here, and hands is over here. Okay, so let's say that he puts his leg on a pin over here, and that causes pain. So then the free nerve ending through the trip channel are going to take the message, and it's going to take it to its cell bodies located in dorsal root ganglion. And the neurons over here are pseudo-unipolar neurons, so they have two extensions. And it's going to go to the spinal cord, so it's going to go in the section of the spinal cord, and it's going to go up via a tract that is called Listauer's fasciculus, I think. So it's and then it's going to synapse one segment up. So it's going to enter the spinal cord at a segment, but it's going to synapse at one segment up. So it's going to synapse. This time it's going to synapse in the gray matter, and it is called lamina 1 through 5. So here you will have your first synapse. Okay, so right after it synapses, it decussates. So right here it decussates, and it's going to go over here. So it's going to go through the lateral spinothalamic. But the fibers that allow it to decussate, or it decussates through, so here you have your decussation. Those fibers are called anterior white commissure. Okay, and then it's going to go up via this pathway, so the lateral spinothalamic or anterolateral spinothalamic, and it's going to go up. It's going to go up, it's going to enter the brain, so, you know, medulla, cerebellum, cortex, and it's going to synapse at the thalamus in the V nucleus called VPL in thalamus. So here you have your second synapse. So after that, it's going to go up via projecting fibers, so internal capsule and corona radiata to enter your primary somatosensory cortex. And it's going to have its last synapse, or its third synapse over here. So primary somatosensory cortex, and it's going to have its third synapse here. So one more time, the information that goes through this tract, it's going to be pain, temperature, and poorly localized touch. So let's say that this guy puts his foot in something hot. Those receptors are going to be activated. They're going to take the information to the cell bodies located in dorsal root ganglion. The axon of the pseudo-unipolar neuron, it's going to enter the spinal cord. It's going to go up via Leger's fasciculus, and then once it goes one segment up, or a few segments up, it's going to synapse at lamina 1 through 5. So here it's going to have its first synapse. Then it's going to decussate right after the first synapse. So it's going to go to the other side, and it's going to decussate via the anterior white commissure. It's going to go up via the anterolateral spinothalamic pathway, and it's going to synapse in the VPL of the thalamus, and then it's going to go up via internal capsule or corona radiata, and it's going to have its last synapse in the primary somatosensory cortex. Okay, so just a couple points to know about the anterolateral spinothalamic pathway. Make sure you know that ventral here, it also means anterior. And the second thing is that in the midbrain, the lateral spinothalamic pathway, actually once it enters the brain, it's going to go through the thalamus via the medial lemniscus. And at that point, if somebody has a stroke in their midbrain, both pathways, the anterolateral spinothalamic pathway as well as the dorsal column pathway, are going to be affected because the two tracks are so close together that they're both going to be affected. So if the patient has a stroke on the right side in their midbrain, they are going to show symptoms on the left side that carries both information. So they're going to have issues maybe with like lack of pain or too much pain, temperature and poorly localized touch, as well as tactile discrimination, joint sensation and vibration on the contralateral side. And that's because right before it gets to the thalamus, and both tracks are really close, so if there is a damage there or dysfunction there, both pathways are going to be affected, and both pathways are going to show symptoms on the contralateral side because both pathways decussate. Although the dorsal column pathway decussates in the caudal medulla and the anterolateral spinothalamic pathway decussates in the spinal cord, but at the level of the brain, they are both going to be contralateral, and at the level of midbrain, if there's a damage there, both pathways are going to be affected.